13 Action News, live at 11.
And tonight, the alarming rise in new COVID cases giving way to risky behaviors. The governor calling it COVID fatigue. Well, thanks for joining us on TV, Apple TV, or wherever you're streaming us tonight. I'm Ty Quinones.
And I'm Trisha Keene. The governor says the state is trending in the wrong direction with new cases and hospital visits connected to the coronavirus. And it's what people aren't doing that could make it worse. 13 Investigates reporter Joe Bartel starts things off tonight. Joe.
Yeah, Todd, Tricia, we've all been feeling this frustrating feeling for months now, wearing the face coverings, being socially distant. After a while, it's quite exhausting, frankly. And now we know that the governor says is not the time to be letting our collective guards down. It's been 222 days since Nevada declared a state of emergency due to COVID-19. 7 months later, the virus is still just as deadly as when it all began.
COVID wasn't supposed to last this long. We all feel COVID fatigue, and it results in riskier behavior and complacency. We cannot let that happen.
During a news conference Tuesday, Nevada Governor Steve Sisolak described the burnout many people are feeling, wearing face coverings, social distancing, COVID tests. A constant vigilance wears people down. Sisolak says the virus lurks when complacency sets in.
Unfortunately, this virus doesn't get fatigued. It's alive and well. It's that simple. We can't get tired because the virus isn't tired.
The concern is with the troubling rise in cases, a rate that has doubled from early September, now averaging more than 650 new infections per day in Nevada. It's a balancing act for hospitals as flu season kicks in.
One day is fine, you're not at the capacity, and a week later you can be bumping up against your capacity for beds and for ICU units.
As for the fatigue or burnout from the virus safety protocols, psychologists say it's real, but it's important to focus on the positives.
We really need to take time for ourselves and to recognize that there are some things we like about the new schedule.
13 Investigates has also learned more about Nevada's playbook for if and when a vaccine will be available.
There is still no hard date or company in terms of which company is going to come with the vaccine first, or what date that vaccine will be made available.
There have been some setbacks with the vaccine development. A number of trials have been paused after some patients fell ill. Out of the 48 vaccines being tested, only 2 U.S.-based companies are in the final third phase of clinical trials. A vaccine, once approved, won't likely be widely available until sometime next year. Sisolak says the priority remains those frontline workers, hospital workers, as well as those most vulnerable to the virus. Those folks will be the first in line when a vaccine becomes available. Reporting live, Joe Bartels, 13 Action News.
Joe, thank you. Right now, here is the latest on the coronavirus numbers in Nevada. State health officials say that the cases are up to 656 since yesterday. 15 more people now have died. Daily positivity rate is at 9.1%. Doctors really want that number to be right around 5. But the good news is that in southern Nevada, almost 91% of people who have had the virus have now recovered. In the valley, the most cases are in the 89110 zip code. Now, that is the general area right near East Bonanza and Nellis Boulevard.
Well, pot delivery